Hello, everyone. So happy to be here today. Okay. Hello. So happy to be here today. We are here on Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a primary care physician and owner of In Touch Primary Care. We're based in Sugar Land, Texas. I'm so excited that you're here. This is the place to be if you desire to take charge of your health and you want to make sure you're doing all you can to live a healthy lifestyle. Remember, you can always listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. You can leave comments, subscribe, and share. Awesome. Today is going to be so much fun. We are getting personal here. I have a very, very special guest with me who happens to be my beloved husband for 15 years. And today I have Damala here with me. Thank you for being here. Do you want to introduce yourself?
Well, yeah. Thanks so much for the invitation. My name is Damola Ashaye, and I'm married to this here beautiful physician, doctor, my buddy, but Adiola Lola Ashaye. So yeah, glad to be here. This is my first Facebook Live, so thanks for making it happen for me. My first Facebook.
Yep. So thank you for doing it. So very excited to have him here. So I wanted him to come here because I have some non-doctor questions for him. And I want to see if he can help me understand a few things also from a male's perspective. And our topic today is men's health. So if you're a man or you know a man that can benefit from being healthier, please listen and share. So before we dive in, Dama, this is one of the questions I want to ask. Why is it so difficult to get men to go to a doctor? I know you can't speak for every single man, but I've been practicing for over 10 years now, and a lot of the men that come in are dragged in. So can you shed some light for me? Why is it so difficult?
Yeah, I mean it's tough to speak for, like you said, it's tough to speak for every man, but I think there are a couple of things that probably drive that. The first thing is, in general, men tend to overemphasize their strengths and downplay their weaknesses. And how that plays into healthcare is, let's say that I have a slight pain or whatnot, or I have a sore throat or whatever it is. The tendency is that I'm going to downplay it and think that, you know what, I can handle that. That's probably nothing. And I'm going to keep going, right? So that's, most men tend to downplay symptoms a lot. So the thought process is, I'm going to get over it quickly. The other issue, I think the other concern that men have with visiting doctors is, in general, when you go in to see a doctor, there tends to be a lot of prodding and poking and you take that off or whatever, which, a lot of guys might find that a little bit uncomfortable, being asked to be, I guess, vulnerable is the word, made to feel, I guess, not in control. So that might play a little bit into it. And then the last thing I think is just lack of information. There's just not a lot of education out there as far as when should you go see a doctor, what's critical, what's important, yeah, it's just. But there might be other reasons that play. But for me, speaking from my perspective, I think those are the big three that I would say.
Okay.
Some of the reasons why.
That makes a lot of sense. I can absolutely see that, the not wanting to be vulnerable, wanting to kind of, make light of things. I could certainly see that. Okay, another question. I know you have a female doctor, right? And you've always seemed comfortable seeing a female doctor. And I asked this, have you always been comfortable? Because I've had women coming to see me and then they ask me if there's a male doctor that they can see for their husband, that their husbands can see. So I know that, every man is different, but do you think there are barriers that could stop men from seeing a female doctor?
Yeah, possibly. I think it goes back to the vulnerability issue. So, most guys would feel, hey, can I be open and vulnerable with this person? That's ultimately what it boils down to. But as far as I'm concerned, I think what has helped me is my, just my background in general. I have a mother that's a physician that pretty much, was, our doctor. I mean, she wasn't our doctor, but she pretty much took care of us when we were sick. And then I married you. So uh, really, it's for me, it hasn't been such a huge deal. Honestly, I would go to anybody really. My criteria for selecting a doctor is more, do I trust them? Can I be open with them? But I could definitely see how men in general would prefer other men just because of that vulnerability factor, being able to open up and trust somebody and someone like that you can relate to, basically. So
Right,
that's
right.
yeah.
That makes sense. I could see that. Do you think being married to a doctor though makes you more or less likely to go to the doctor?
Yeah, by far, yeah. Well, well, let me think about that. I think it depends. So if it's minor issues, so I think the benefit is that if there are things that I have symptoms, if I have some symptoms and I come ask you, you can say, hey, no, that's not a big deal. Just take a Tylenol or something. So with the small things, I think is less likely for me to go. But
Right.
when it comes to your regular checkup and making sure that you're getting your screenings done and those kind of things, I think you're definitely on that. You make sure that I get on that. But as far as the little stuff, I think that's the benefit of having it there. So just, hey, I have this going on. Oh, wait, not that. Don't worry about that. That's just a little something. You get over that quickly, right? So so there is a benefit to it. There are lots of benefits to it. So
Right, right. Okay, yeah, I guess
you
that
can
does.
marry a doctor. That
That's the take home message, right?
yeah. So,
Got it.
yeah.
All right. So what questions do you have for me about men's health?
Yeah. Okay. Yeah, well, if you're talking about men's health, I think the most important question is, what are some of the screenings that need to be done for men,
Mhm.
and at what points in their lives, at what age do they need to get those screenings done? What's important uh, for
Okay.
for men of specific ages?
Yeah, I think that's a good question. That's one that comes up commonly, and generally, I'm going to talk about three types of tests, right? So, there's general screening for men, and that's typically done by lab work, like blood work, and that should start really at 18 when you're an adult. And how often it's needed will depend on the person's risk factors. So that's like, what kind of medical history do they have? What kind of family history they have? If or how much do they smoke, or how much do they drink alcohol? Um, so those will drive how often we will check lab work in people, depending on their risk factors. Men generally develop heart disease at a younger age than women, and death from heart disease and strokes are higher in younger men when compared to younger women. So it's so important to check lab work for things that affect the heart, and also checking things that affect the liver, the kidney, vitamin deficiencies, anemia, sexually transmitted infections. But the good news is, there's a lot we could check for, but if we catch it early, we can prevent serious health conditions. So that's the advantage of checking. So the first thing I'll say, blood work, and blood work can be for so many things. There are many things we can screen for. A lot of it for men will be heart related, especially early on. And we start at 18, depending on what else may be going on in their lives in terms of risks, that would determine how often. Some people, it could be every 3 to 5 years. Some people, it could be every year. It just depends on what's going on with them.
I
So
see. Okay.
yeah.
So in general, is it advisable to do it at least a full physical every year? Would you say it's
So
okay?
a physical is the screening tests out a little bit different from physical. Physical is an exam where your doctor is actually listening to your heart, your lungs, checking your belly, all of that, and then assessing your risk to determine whether or not you need tests. right? So doing a physical every year is important because that's when we find out, oh, your risks have changed this year. Something happened last year with a family member that didn't happen the year before, so things change. And that's why it's good to check in every year. You may not end up needing a test every year, but you should be checking in every year because to make sure that everything is fine.
Yeah, yeah. And you mentioned risk factors. So race, color, all that stuff kind of comes in play. So
Yeah,
for
so it depends on,
African men specifically, what are the screenings that, and how, what are some of the things to look out for in terms of health screenings and all that?
right. So for Black men, especially, there are certain things that are more common, right? So, or that we start to screen earlier. And that actually takes me to my next thing, which is specific for men only, which is prostate cancer screening, right? So prostate cancer screening should be done after talking to a doctor. Only men have a prostate, so it's only men that get prostate cancer screening, right? And there needs to be a discussion about the risk and benefits of screening. Risk can be that you can get unnecessary testing because, if there's a false positive, meaning that they thought they saw something, but there really isn't anything there, but you have to do all this tests. But the benefit, obviously, is finding cancer early, which when it's found early, it can be treated and often cured. So screening can be done with a blood test alone. And this is where you talked about race comes in, right? So Black men are considered a higher risk for prostate cancer. And so for people that average risk, we can start screening at age 50. But for people that are higher risk, we recommend screening to consider screening starting at age 40, between 40 and 45. So if they decide, if a man talks to the doctor and they decide, okay, yes, I think we want to go ahead and screen, using a PSA, which is the prostate specific antigen blood test alone, can be enough for screening, and a man can screen up until age 70. So that dreaded rectal exam, I know a lot of men have like nightmares about it. That's no longer recommended for screening. I mean, that exam can still be done for other reasons if you have symptoms or other things, but men don't have to, you can fear no longer. They can come in and have a blood test. And, obviously, if there's something found, you may need the exam, but in terms of screening, most men can get away with just a blood test.
Okay. Well, that's good news for my fellow brother.
For the male species, right? Right.
This is a recent development. Is this how
Not so recent. I mean, it's been around, it's been recommended for a few years, but it takes a while for everybody to catch up. But yeah, with the blood tests, you can do screening, and then following that, if there's need for further testing, that can be done as well.
Okay. Wonderful. Wonderful.
Yeah. So I think, yeah, those will be the biggest, those two screenings, blood screening and then prostate cancer screening. I'll talk about one more. There are many other types of screening tests, right? So there's lung cancer screening, there's bone density screening for osteoporosis, there's aortic aneurysm screening, but those ones apply to people that have risk factors. Now, this one I'm going to talk about applies to all men. So colon cancer screening. This is another one that a lot of people in general, men and women, should get, but a lot of men dread. It should start at age 45 now. So this is a change. It used to be average risk people were supposed to start at 50. Now that's a change. The recommendation is starting at 45 for average risk people. And it can go on up until 75 or longer, depending on how healthy the person is. So,
is that for African Americans, or is it?
For everyone, African Americans are considered average risk for colon cancer. So yes, so then as well, they'll start screening at 45. Now, the age of screening could change depending on the person. Like if the person has a family history, for instance, that of early colon cancer, we may start screening earlier for that person. And so that's where discussion with the doctor, not assuming that it's the same for everyone, comes in. So depending on where you fall in that risk, that would determine how early you start. So The thing about it, the best way to screen is the colonoscopy, right? And that's what most people are concerned of. The good news with the colonoscopy, though, two things. If you actually have the colonoscopy and they find something, they can take it out right away most of the time. So they're treating it, they're managing it right away, which is helpful, right? So you don't have to go back for a procedure most of the time. Now, the other good news is if everything is normal, you don't need one for another 10 years. So it's the best way to screen. If everything is clear, you have a whole 10 years to be free, right? If you really, really don't want to have a colonoscopy and you want to do, but it's still important to screen, there are other ways though. There's stool tests that have been shown to actually reduce the risk of death from colon cancer. So the thing about stool tests, though, most of them need to be done yearly. So there are options for screening. So people, some people don't do it for cost reasons or for discomfort reasons or for health reasons, but there are other ways to screen. So it's really important that you still get your screening in, even if you are not, even if you are not going to get a colonoscopy.
Okay. And then most insurance companies would cover some of these screenings, right? Are they generally covered by policies? Or?
So for screenings, yes. So if it's a screening, for people that have insurance, if it's considered a screening test, many of them will cover it. But with insurance, it just depends on the type. But for many screening tests, they're covered. And then those that don't have insurance, there are cost-effective ways to do that.
Okay.
Yeah. Awesome. So that I would say those will be the main things I want to point out. Blood tests start at 18. How often depends on your risk factors. PSA or prostate cancer screening, you could start at 40 for most high-risk people, including African-American men, Black men, and 50 for average risk people, average risk men, and then colon cancer screening is the big one. Don't be scared. There are other ways to screen if you absolutely don't want to do a colonoscopy, but just don't not screen. So, yeah.
So in your practice, do you have some kind of a process to kind of make guys feel better?
We have to give people water. No,
no, it's like a session where I lay their fears and say, hey, this is not a big deal.
Well, we try. I mean, it depends on the person, right? There are people that are not, they don't, and men and women, honestly, some people are not bothered. And then there are people that are really bothered by it. And we try to encourage them, especially if they need it. We do really try to let them understand it's really not that bad. It can't, it's the alternative is not pretty, right? So you don't want to have cancer. So the faster we can get it, the better. Because if you do have cancer, you will really be, it's a lot harder to manage. So, yeah.
It's way more invasive and
way more invasive. Yes.
So yeah, that's enough motivation, I think, for
right for some people. Yes. So, okay, I'm going to ask you a few more questions before we end here. Okay. And I'm going to do, and these are going to be like rapid fire questions.
Okay.
And you need to tell me, you need to ask as quickly as possible. Okay.
Okay.
All right. So we're going to start. What type of junk food won't you give up?
Popcorn.
I knew you say that. Name a song that makes you happy.
Is it?
No, it's good. It's one of the healthier snacks.
Okay.
Good. Name a song that makes you happy.
Any Christmas carol. Hark the herald's angels sing.
Okay. If you had an unlimited supply of one thing, what will it be? Don't say toilet paper.
Toilet paper, I mean. Toilet paper.
Oh my God, you are one of those people, right?
No,
okay, what is it?
Love.
Oh, that's
love.
cute.
Your love.
What's your that's very sweet, thank you. What's your favorite holiday?
Christmas.
Yeah, colonoscopy or stool test?
Well, seeing as I don't know what a stool test feels like, I'm going to go with colonoscopy.
Okay. Get it done first or wait until the last minute?
Oh, get it done.
Okay. Breakfast food or dinner food?
Dinner.
Morning person or night owl?
Morning person.
Yeah, that's awesome. So now you know all about them all. Okay, so
Yeah, that's pretty much. There's not a lot to it. Just those questions you just asked me. Pretty much sums me up.
okay. All right. So the bottom line is, if you're a man and you're not going to the doctor, please do. You know, many people feel fine, but then you don't know by feeling fine whether you're fine or not. So unfortunately, feeling fine is not an indication of being fine. So please get checked out. Men, don't avoid the doctor. And if you're in the Houston area and you don't have a primary care doctor, or you're looking for a doctor to support your journey to a healthier you, check us out at In Touch Primary Care. We're currently accepting new patients. We do things differently here. Our practice is set up so we can actually serve our patients in the best possible way. You can find out more about us on our website, www.intouchprimarycare.com. And, you know, if you have any comments, if you found this helpful, please share and subscribe to the YouTube channel. Thank you for joining us today. And thank you, Damala, for being here today. Any parting words?
Well, thanks for inviting me, and thanks for the wonderful work that you're doing. I'm so I'm amazed and enamored by doctors. You guys are wonderful, and I appreciate all the hard work and dedication that you guys put into to make us feel better and take care of us. So I'll keep up the good work, and thanks for inviting me to my first Facebook Live. So I enjoyed it. Thanks for having me.
Awesome. Thank you, Dave. All right, that's all we have for today. See you next week, 2:15, or on Facebook Live. And if you miss it, you can always catch the full video on our YouTube channel, In Touch Primary Care YouTube channel. Bye-bye.
All right. Thanks, everybody.